Vaccines don't save lives. It's vaccination that saves lives. The Delta variant is a mutation that occurred in the SARS-CoV-2 virus, which has made it more contagious, and I think, made it more aggressive. It has replaced the other variants in the United States, so that at this time, 90% of infections that we see are caused by the Delta variant. The contagiousness of this particular strain or variant is twice as much as the regular COVID-19 strain. And if you want to put numbers on that, the standard strains of COVID-19, one infection would lead to either 2 to 4 new infections on average. With the Delta, it's 4 to 8, so it's twice as many people become infected in an unvaccinated population. We're also seeing more aggressive disease in younger people with the Delta strain. Originally, it was people in the 50s and 60s and 70s that would come into the hospital. Now we have patients in their 20s and 30s. So the Delta variant is a problem, and it's the predominant strain in the United States as we speak. Yes, this virus keeps mutating. And if you look at the Greek alphabet, we were alpha, beta, gamma, delta. Now we've reached till mu, which is M. So we have had so many mutations. Now, some of those mutations are unsuccessful in the sense that they're not as aggressive or as contagious, and therefore they get extinguished. But there are other mutations that could be even more aggressive than the Delta, and that's one of the concerns. There are opportunities for error as the virus is replicating and the genetic material is making a copy of itself. It's like when you make photocopies of a document. Each photocopy can be a little bit less authentic than the first one. So there are opportunities for change during the process of replication. I consider people that are unvaccinated and that have the virus in them to be variant factories, because that's where the variants emerge. The more patients that you have that are ill and they have the virus replicating inside them, the more opportunities for the virus to become mutant, which could eventually evade our vaccines. So it's very important as a population to get more and more people vaccinated. So boosters are something that we're talking about. And again, all this is driven by science. If we find that people that are vaccinated are ending up in hospitals and they're becoming really ill, then it's appropriate to give them boosters. Recently, the CDC did recommend that immune-compromised patients, which would be HIV patients with uncontrolled HIV, or patients on biologic medicines like Humira for rheumatoid arthritis, or patients on high doses of steroids. So immune-compromised patients in those categories should get a booster, because over 6 to 7 months, they've seen a little waning in the antibody titers in these patients, which puts them at higher risk. However, as we speak, we do not have a recommendation from the ACIP, which is the Immunization Practices Expert Committee, about the general public. Well, there's this story I was reading just yesterday about 2 identical twins in Florida. that used to work in a mechanic shop, and there's an outbreak of COVID in that shop. And one of those identical twins was vaccinated and the other was not. And it turned out that the unvaccinated went on to get hospitalized and died, even though he had exactly the same genetics as his brother. So it's not your genes, your immune system, or your background. It's whether or not you are vaccinated against this particular disease. Vaccines don't save lives. It's vaccination that saves lives.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.